Hi, Dr. Liu here. You've decided that you're going to do your own dressing change, and I just wanted to walk you through what we do during our dressing change in the rooms. I have Nurse Mel with me, and she's going to talk you through and show you a little bit about what we do in the post-operative period at the 2-week mark. If you are doing this yourself, please don't hesitate to contact me if there are concerns. If you have decided to do your own dressing and you don't have a dressing pack, sometimes it is beneficial for you to call in to see your general practitioner instead. Usually by now I provided you with a small bag with the Hyperfix dressing in it and a little swab with some betadine or an alcohol swab to run over the wound at the time of your dressing change. If you don't have these, not to worry, we can talk through another option for you, but following this, just a short video to show you what to expect after your hip dressing is removed. Thank you, and any questions, let me know. Okay, so we have our hip wound here today, and our first thing to do is just assessing and making sure that everything looks nice and clean. It's been kept really well, and the white indicator strip just in the center has no fluid on it. So first thing we'll do is we clean our hands just to make sure that we're as clean as possible when we're changing the dressing over. And then just in one nice easy movement, we will remove this dressing. The dressing is called IV3000, and it comes off relatively easily, revealing just those under steri-strips. You will notice that they will be a little bit stuck on, so just peeling those off gently from one side to the other. There might be just a tiny bit of dried up blood, which we can remove in just a moment, and there may also be a slight purple tinge to that, because the purple tinge is actually the antibacterial glue that we place over the top. So once we've done that, and you can see there's just a tiny bit of scab there, which we actually leave on, but we use a little bit of a iodine or betadine swab that we just swipe over the wound once, and you're just doing that just to remove any potential for little bits of bacteria to get in at a later stage. Lovely. Thank you. Just one nice swoop. You do not need to rub this hard, and I would prefer that you don't rub it too hard when you're doing that. We don't need to remove all of the scabs and things there. We have the Hyperfix dressing, which you'll receive. That Hyperfix dressing is to place over the wound. It is a non-waterproof dressing, and one that is designed really just to protect the scar from the clothes, especially underwear elastic lines, which may rub over especially this top edge of the wound and can cause just a bit of abrasion to the top. So we just make sure that any underwear that you're wearing is a little bit loose. Once that's on, you can get that as wet as you would like. You do not need to keep it dry. In the shower, you just pat that dry, don't rub it dry, and that should last on for a good few days, up to a week or so. You can leave it on until it falls off on its own. Thank you.